Hello, dear students and esteemed learners. Welcome back. Welcome to my course on Sociology of Health. And as of now, we are discussing the theme on health of children and vulnerable groups. And in the previous lecture, we tried to understand the concepts related to health of children. We tried to understand the concept of early childhood development and then the framework of nurturing care. Now, this is lecture 47, and in this lecture, we'll talk about health of children in India, the disparities, and the government initiatives. So, this is a fairly big topic, which health of children, and so we divided this into two parts. We did the first part, and this is the second part. Although we have been talking about health of the children in various other topics, for example, when we were talking about the Millennium Development Goals, then we were referring to the achievements made in the field of health of children, or when we were talking about the Universal Immunization Program or the Disease Control Program. So we were talking about these things, but in these lectures, basically, we'll try to look at the things at a more comprehensive level and then try to understand the larger narrative which is building up, right? Because as a student of sociology, we would like to understand the larger mechanism or the larger discourse, basically, which is gradually building up, right? So our concern with these individual programs is related to that. I've included many concepts here. We will not discuss those concepts at length, but basically we need to talk about those things because those are the part of that larger trajectory, right? So the declaration of Astana of 2018, then the interstate and rural-urban disparities existing in the domain of health of children in India, and then the goals basically set by National Health Policy 2017, and then the facility-based integrated management system and RMNCH plus A, something that we discussed earlier also, and then the mission Indradhanus and some of the other important recent initiatives, right? So these are the things that we intend to discuss, and with this background, we are moving to our first slide. So the declaration of Astana is very important because it talks about three important things. First, primary health care. Second, for all. And third, it basically identifies the disparities existing in health outcome. So it was very relevant to begin with this so that we can understand that what kind of disparity is already existing and the world or the global community is identifying that. The world, the world community showed new global commitment to primary healthcare for all at Astana Conference 2018. Now, here I would like to read one statement given by Henrietta Fore, the executive director of UNICEF. This statement is very important. It helps us to understand the state of health of children in world as of now. The statement says that although the world is healthier place for children today than before, close to 6 million children die every year before their 5th birthday, mostly from preventable causes, and more than 150 million are stunted. So it basically summarizes the larger picture. Although there are achievements, because the situation as of now is much better than before, but despite that, the situation is actually not very good because because children are dying because of the preventable disease. Uh, Disease which could have been prevented from their occurrence, right? And then stunting is a very big problem. Now, stunting in itself is indication of the prevalence of undernourishment, right? And from other sources, we get to know that the world is still suffering from the problem related to hunger. The global hunger index is basically talking about that. Then we have the human development index every year, and we get to know that a good number of countries are performing very badly, right? So those are actually the indication that not everything is going well, even in terms of the basic requirement like nutrition, or for that matter healthcare, and then primary healthcare, right? So this declaration of Astana, which came after 40 years of the Alma Ata declaration, is basically again focusing on the primary health care, and also talks about the kind of disparity which is already existing. And the Astana declaration recognizes that remaining healthy is challenging for many people, particularly the poor, and the state, and it states that it is unacceptable that inequity in health and disparity in health outcome persist. So directly, it's linking with the state of income or poverty, right? Because healthcare at some level is directly related with the social determinants like income and other deprivations. So poverty in itself is a big handicap or constraint in the path of achieving the goal of healthcare for all and health for all. And we all understand and know that the world is basically witnessing the problem of poverty. And so the Millennium Development Goals and Sustainable Development Goals, we're talking about the problems related to poverty. Now, poverty creates actually problems which are multidimensional and which create a kind of vicious circle. So, unless we are in a position to address that, we will not be in a position to address the other related things which are actually very much dependent upon these social determinants. So with this kind of background, we need to understand the declaration of Astana. Then we are talking about disparities prevailing in Indian states, and so we are making use of the National Family Health Survey for data, which were conducted in 2015-16, and the data was made available in 2017. We talked about this when we are talking about the disparity existing in maternal health and other related things. So yes, we have used this data. Now let us try to understand the kind of health condition of the children in some of the major states of India as per the information provided by NFHS 4. Here we will go through some of the important indicators. Now the slide is basically showing us the percentage prevalence of total children aged 6 to 23 months receiving an adequate diet. 6 to 23 months, because up to the age of 6 months, children are basically dependent on the breastfeeding. So afterwards, they are supposed to take the supplementary food, and because of the increasing nutritional requirement, the kind of food that the children are getting is very important, because that will play the most important role in their proper growth. So what is the condition as per these figures? You can see that at all India level, basically, it's less than 10 if we go by the aggregate of the rural and urban. That means only about 10% of the children aged 6 to 23 months are receiving adequate diet. The rest are not getting. Now, to what extent that inadequacy is varying, that is a subjective thing. But whatever statistics is available, that is actually alarming. Now, another important thing, if you see the highest performing states like Tamil Nadu, even in Tamil Nadu, this is around 30 only, right? That means the best in itself is not performing very good in terms of this specific indicator. And if we want to see the states which are performing very poorly, then the situation is actually very problematic, like Rajasthan, Gujarat, Uttar Pradesh, Punjab, Maharashtra. All these states are actually around 5%, 5 to 6%, or even less than 5%. And then another important thing is basically the disparity which is existing between the urban and rural areas. We can see that almost all the states, except in Gujarat, there is a kind of disparity between urban and rural. That means the problem is persisting at a larger level. Now, 94% children aged 6 to 23 months not receive an adequate diet as per NFHS 4 figure. And this is actually revealing the kind of health situation and the nutrition situation is prevailing at that level. Then in this slide, we will talk about the non-breastfeeding children in the same age group, that is 6 to 23 months, receiving an adequate diet. So the non-breastfeeding children are exclusively depending upon the food that they are getting because they are non breastfeeding children, right? And so the adequacy of the food is very important here. And the situation is almost like this. We can have the poor performing states like Gujarat, Rajasthan, Madhya Pradesh, Odisha, Uttar Pradesh, Punjab, etc. And the better performing state is Tamil Nadu. And then to some extent, Jammu and Kashmir, and slightly closer to that basically is West Bengal. So these are the states, but unfortunately the performance of the good performing country or the best performing states is also not very encouraging. That means all the states are actually not performing well. Now some are performing very poorly and some are performing comparatively slightly better than the poor performing states. But overall the situation is not very good as per the NFHS 4 figures. However, as we will see that the situation has improved in last few years, basically because of several incentives and because of several initiatives taken by the government, right? So the NFHS 5 data will tell us the other kind of details at the level of the states. So if you happen to see at any point of time the NFHS 5 data, then do try to go for the details because that will give you further insight. Then children under 5 years who are suffering from stunting. Now what is stunting? Stunting means when the height is not growing with age during childhood. So it's a serious problem, and the prevalence of stunting is very high in some of the states like Bihar, Uttar Pradesh, Jharkhand, Madhya Pradesh, Rajasthan. All these states are having a prevalence of stunting between 40 to 50. Now, there is a huge difference between rural and urban areas also, and all the states which are basically having high prevalence of stunting are also showing high rural-urban disparity. Some of the states which are performing better are basically Kerala, Goa, Tripura, and Punjab, right? And to some extent Tamil Nadu, etc. Right? So this prevalence of stunting is actually a very serious indicator of the prevalence of malnutrition. And if this is prevailing at such a larger level, then this kind of problem related to malnutrition is certainly creating various other complications also, which could be identified in terms of the non-communicable disease. because the communicable disease basically is spread because of the environmental factors. Of course, the immunity of the person is very important in that, but the causation factor is basically existing outside. But in the non-communicable disease, basically the problem is very often originating in the body itself because of the presence of certain types of elements, or you can say any causative factor. So this problem of stunting and then wasting or underweight or malnutrition, all these things do complicate the situation related to the non-communicable disease also. So we need to have that kind of connection in our mind also. Then we have the figures related to NFHS 4 and NFHS 3, and the comparison is there. So you can have a look on that which of the states are basically performing better, and which of the states actually is not performing well in terms of the time gap also. So that will indicate you the further problems. And let me share with you here that the problem related to nutrition is not always related to availability of food, because some of these states are actually economically rich states. That means the problem is not just about availability. It's also about the kind of practices basically which are prevailing. So whether people are aware of the nutritional requirements or not. So it's more about education, it's more about awareness than about availability of food. Then similarly, we have the situation related to wasting, that is the weight is not increasing with height, and the prevalence is again like the previous problem. The states like Jharkhand, Gujarat, Karnataka, Madhya Pradesh, Maharashtra, Chhattisgarh, all are having the prevalence varying between 25 to 30. And then the good performing states are basically like the Mizoram, then Jammu and Kashmir, and Punjab and Kerala, etc. Right. Now, one interesting and alarming thing I have identified here is this, that the all India average of wasted children under 5 years has increased to 21% in NFHS 4 from 19.8% in NFHS 3. So there can be some error because of the sampling and all other things that we can admit. But even if we accept those things, but the overall picture, we get an idea about the overall picture through these statistical information, and the overall picture is suggesting that the problem is serious and we need to take care of. And of course, the recent initiatives taken by the government of India will show you that the government has taken cognition of these things and several initiatives have been taken. Then problem related to underweight. So it's also like the problem of stunting and wasting, and the performance of the various states are there. So you can have a look and try to understand the things. Now we come to a different category, basically the children age 6 to 59 month who are anemic, right? So earlier we talked about the adequacy of the diet, and now we are talking about the prevalence of anemia. So what is anemia? Basically, anemia is actually a lack of blood. In common sense use, we understand anemia like that only. And at a technical level, basically, it is stated that it is when the RBC is not in the due quantity, then that is basically identified it. And there are several implications related to that. And very often, most of the problems of a child, health related problems, are somehow also having some kind of connection with the prevalence of anemia also. This problem is very severe among the pregnant women, and we talked about it in the previous lectures. But this is very serious among the children also, because among the children we are having the girl child as well as the male child and the girl child. And if this problem is persisting right at the at this stage, at the stage of childhood, then the problem will continue, at the adolescent level, and then again that will create complications when they will have their marital life, or when some of them, or maybe as depending upon their own choices, when and the preferred age when they will conceive, and that problem will get reflected also, right? So this is the situation which is prevailing. All states of India show improvement in the situation, and the all India average has declined from 69.4% in NFHS 3 to 58.4% in NFHS 4. So, the important thing here is this, that the problem related to anemia is actually decreasing. The situation is improving, and we have seen that the prevalence has declined. Then we talk about the goals related to uh, health of the children, and we have been talking about these goals in the previous lectures also. So these are basically mentioned over here, so you can have a look. You are already familiar with these things. Then we talk about the recent information about the infant mortality or neonatal mortality and the under 5 mortality rates as per the SRS data. This statistics is provided by Government of India in the ministry's website, or basically the National Health Mission's website. I have given the link also here, and you will see this, that there is improvement in all the three indicators over the last 5 years. So from 2016 to 2020, all the indicators have improved. Although these are not coming up to the desired level, but the improvement is there. And that basically indicates the success of the kind of strategy that the government is following, right? So now we come to this part where we need to understand basically the government initiatives to improve the health of children. Why do we need to talk about this? We need to talk about this because we have been talking about the kind of problems that are existing. So when the problems are existing, that the governments are basically supposed to take the proper initiative, and the programs will not be successful unless the participation of the people is there in the programs. So we need to know about these things, not only for the academic reasons, but also as the informed citizens of the country, so that we can create the kind of awareness which is required. Because at all models of the all at the level of all the models of healthcare promotion, we get to know that participation is very important. Without participation of the people at large, we cannot make any health program successful, and especially the health programs related to children. So we need to have a broader understanding of this. Now, first and very important thing is the umbrella term RMNCH plus A. We talked about it in the previous lecture at length, so you might have understood it very well, but it is basically an umbrella term which talks about reproductive, maternal, neonatal, child health, and adolescence, plus nutrition. Earlier, it was not talking about nutrition when it was started in 2013, but later on the word nutrition is added because we have seen that good number of problems are related with lack of nutrition. So this kind of basically dynamism we can see, and this is what basically we are interested in knowing, that if the problem is persisting, then whether the government is addressing or trying to address the problem or not, and that is quite visible that the strategy has changed. Then we are already aware of the National Health Mission, basically, which is taking care of both the rural health mission and the urban health mission, right? We already know about that. Then very important thing is the facility-based integrated management of neonatal and childhood illness. So there are basically neonatal and childhood problem, illness. And there is a kind of strategy which is known as the facility-based integrated management of neonatal and childhood illness. And basically the health facility centers are basically empowered and well equipped so that they can serve the needs of the children to address various illness related problems. So this is very important. Then we have learned about the universal immunization program, and this is known as Mission Indradhanush. And Mission Indradhanush is basically a kind of umbrella sort of mission in which the immunization needs of the children are taken care of. And then we have also talked about the disease control programs, and there are good number of disease control programs which have helped in eradicating some of the disease, and then controlling some of the communicable disease, right, and then making improvement in several other diseases. So these programs are applicable for making improvement in the health of the children, right. So there are actually among these the group of the children, we are having actually two three category. One is the neonatal category, which basically depends exclusively on the care given by mother, then the breastfeeding, the immunization, and the intensive care which is provided by the specialist medical centers. Then we have the infants, basically, who depend upon the nutrition as well as the medical services, and they need vaccines, and then they can get benefited by the larger health system also. And then we have the children who are basically coming under the under 5 age, but above the neonatal category. So they are the beneficiary of all the other infrastructure and the public health system and the healthcare system, etc., right, because all other facilities could get extended to these children. So there are actually different layers, and we need to understand those things for having a fair understanding of the initiatives which are taken. And then we are also having the mobile medical units and the telemedicine in rural areas, and then tribal areas, basically where access is difficult. Then in those areas, there are provisions of mobile medical units and telemedicine, so that people should get the health facilities and the medicines when they need. Then there is Ayushman Bharat program for the holistic and integrated health care, and it is the principal vehicle for the achieving of universal health coverage. So we will talk about universal health coverage in forthcoming lectures, but we have already made you understand the concept. And in India, basically, the Ayushman Bharat program is the umbrella program which is trying to achieve the goal of universal health coverage, and there are several components which are related to making positive intervention in the health of the children. Then we are having the concept of health and wellness centers under the Ayushman Bharat program. And then also we are having the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So there are different types of programs. Some of these are basically related with the financial need of the parents. Some of these are basically related with the kind of facility which are required. And some of these are related with the kind of curative approach which may be required to address the problem which is existing. So I have included the different types of program in this slide, and in the next few slides we'll talk about some of the specific programs. So we already talked about this RMNCH plus A strategy, and then facility based integrated management of neonatal and childhood illness. Basically this is based on integration of the facility based care package with the IMNCI package, right, to empower the health personnel with the skills to manage newborn and childhood illness. The problem is this, that the health personnel are not having the necessary skills very often, and so making the health personnel equipped with the kind of skill required is also very important, because the problems are actually multidimensional. I have mentioned some of the diseases also where this approach is very effective. Then Mission Indradhanush, we talked about it. Full immunization coverage to children basically reached to the level of 90%. Then Janani Shishu Suraksha Karyakram, basically this program is taking care of not only the health of the mother but also the newborn, right, and the finances related to that is also taken care of by the government. So the financial aspect is very important, because when people are coming from a very poor family, or they are not in a position to afford the kind of healthcare required, in that situation this program is becoming very effective. And then intensified diarrhea control. Yes, diarrhea is one of the largest killer during childhood, and so there is an intensified diarrhea control program, and more than 14.7 crore children were reached through this campaign since 2014. Then National Deworming Day. Basically, worming is one of the important causes of anemia and a good number of childhood problems. So there is a specific intervention in the form of the National Deworming Day. And then we have one big program, that is the Rashtriya Bal Swasth Karyakram. That is, Bal Swasth means health of the children, and it talks about basically 4 Ds, that is the defects at birth, then disease, then deficiency, and development delays. And it talks about early screening. Early screening is very important for identifying some of these problems, and especially if these are the congenital problems which are basically related to the birth or the birth defects, right? So this is a big program, massive program, and it intends to provide healthcare and support to children at the earliest level. Then there are few other major initiatives also, like the essential newborn care at facility, then home-based newborn care, then promotion of breastfeeding and timely initiation of the complementary feeding, management of cases of severe acute malnutrition, then micronutrient supplements. So with this, we have covered two very important aspects related to health of children in India. First, the kind of disparity or deprivation is existing in some of the states, and then some of the districts, and basically then what kind of initiatives have been taken by the government, and to what extent those initiatives are basically making the right kind of changes, right? We have seen that the situation is improving, so the challenges are there, but basically the efforts are made by the government, and basically people need to participate. People need to keep themselves aware so that they can get the benefits of these programs, because without people's participation, no health initiative could become successful. So one of the goals of including this topic in our course is this, that we all are directly getting influenced by these kind of initiatives, so we can think about this, we can understand this, and we can also create some kind of awareness at a larger level, so that we all can play our role for achieving healthy India, and India which is free from all types of problems related to healthcare of the childhood. So thank you very much for being with me, and we will meet in the next lecture. Take care.